Mr. President, I rise on this early evening in July to spend a few minutes to talk about health care. I know it's been obviously a subject of great interest over the last number of days, and having been asked to fill in for my dear friend Senator Ted Kennedy, who, as we all know, is struggling with his own health issues, the chairman of the Health, Education, Labor, and Pensions Committee. I was asked to fill in for him to mark up the Health Committee's legislation on health care. And I was fortunate to have as my allies in that effort some remarkable members of this body, both Democrats and Republicans, who we are told spent as long a time, maybe longer than any other markup in the history of that committee, and one of the longest in the history of this body. Some 23 sessions over 15 days, covering somewhere around 300 to 500 amendments that were offered on behalf of the 22 other members of the United States Senate, almost a quarter of this body serving on that committee. And after that lengthy period of time, we drafted a bipartisan bill, substantively a bipartisan bill. It did not end up being a bipartisan vote. It was a partisan vote coming out of committee, regretfully. But that doesn't mean it will end up that way. I've often been involved in legislative efforts where the committee action would have a partisan conclusion, only to find that after further work, those efforts can attract broad-based support and develop the kind of broad-based backing that is, I think, an important feature of good legislation. So while I regret I didn't have any Republican votes that joined us in that committee, I am deeply grateful to my Democratic colleagues for their efforts, but also to my Republican colleagues, which I'll talk about, because I intend over the coming days on a daily basis to talk about this issue. Through the process here, remaining weeks, we're in session, and possibly even beyond that, if we stay in session in August, to work on this issue. This is not any ordinary issue, ordinary time. I've been around long enough now to have witnessed the debates on this issue going back 30 years. And every single Congress and every single administration predating my arrival here has grappled with this issue. Republicans and Democrats, since the days of Harry Truman in the 1940s. Literally every administration has tried to come up with an idea to reform our health care system. In years past, Mr. President, those efforts were talked about in terms of describing the present condition of health care as being an unacceptable situation, that it was wrong, it was not ethical, it was not moral, we weren't serving people who should be served. The debate has now changed, because it's no longer unacceptable, which it's always been. We're now in a situation where the present conditions are unsustainable. Yesterday and again this morning, the chairman of the Federal Reserve Board, Ben Bernanke, testifying on monetary policy, but was asked the question in both the other body as well as in the Banking Committee, which I do chair, how important health care was as a matter of economic recovery. And in both forums, in different language, the chairman of the Federal Reserve, while not getting into the details of the various plans, pointed out once again, if there was any doubt about this, that unless we resolve the health care issue, that the economic issues we are grappling with today will be unresolved and only grow in their complexity and in their depth. And so this issue of health care is obviously one that affects people, real people every day, not to mention the 14,000 today as we conclude business here in the East Coast and will in a few hours across America. Today, remember this, and every day remember this, as we grapple with this issue. 14,000 people of our fellow citizens will lose health care today. 14,000 will lose health care tomorrow, and the next day, and the next day, and the next day. And every day that we wait and delay on this issue, that many more of our fellow citizens and their families can fall into that abyss, that free fall, of wondering whether or not some accident, some injury, some diagnosis will tell them and their families that they are in deep trouble from a health crisis perspective. And if they lack the kind of coverage and insurance, or lack the kind of personal wealth resources, that family will not only face the hardship of confronting a health care crisis without care to provide for them and their families, but they may very well find themselves in economic ruin as a result of the situation that persists today. And I'm not talking about the uninsured alone. I'm talking about the 25 or 30 million who are underinsured in this country. They today struggle every single day, wondering whether or not those deductibles are going to be low enough to meet the crisis, and even if they have a policy, whether or not they're going to be adequate number of doctor's visits, prescriptions, and the like that will provide them with the necessary protection to recover from their health care situation and avoid the economic crisis that can befall them. To put it in perspective for you, Mr. President, consider this. Of all the bankruptcies that occur in the country, and there are many in economic times like this, 62% of those bankruptcies are directly related to a health care crisis in that family. That they would not be in that situation except for the fact that they are suffering through a health care crisis that has forced them into financial bankruptcy. And consider this, if you will, Mr. President. 50% of all home foreclosures, and there were 10,000 of those today. 10,000 families got a foreclosure notice. 50%, 1 out of every 2 foreclosures that occurred in this country occurred because of a health care crisis in that family. So on bankruptcy, on foreclosure, the 87 million of our fellow citizens who every day, or every year rather, find themselves in some period when they lack health insurance. And yet, as I say all of that, and from this chamber, all 100 of us here have a great health care system, the Federal Employees Health Benefit Package. All of the federal employees in the Capitol across this country have a good health care program, the Federal Employees Health Benefit Package. Maybe if we were in the same situation as many of our fellow citizens, either being uninsured or underinsured, maybe there'd be a heightened sense of urgency about this issue. But as long as you're okay and nothing to worry about, because of the jobs we hold, the titles we have, because of the good health care at relatively low cost that we have, none of us have to worry about that. We hope nothing happens. We hope we don't get sick. We don't hope a child of ours or a grandchild doesn't face an economic crisis or health care crisis. But if they do, Lord forbid, we have the resources to protect our family. That is not the case. That is not the case for millions of our fellow citizens. And so this issue demands our attention. It is an issue that cries out for solution. It's one that we must address. This is not one we can delay on. It's not one we can postpone for some future Congress. In fact, the American President, Barack Obama, will address the country about 55 minutes from now on this subject, has made the case publicly. There is no other issue that is more important to him than this one. He has announced that he's willing to expend whatever political capital he has in order to resolve the health care issue. He's made it the central issue of his presidency. And we in this body, regardless of what political label we wear, I think bear a similar responsibility and should be sharing a similar cause. And that is to address this issue in a way that will increase access, will reduce cost, and create the kind of quality program that all Americans ought to have. Every American ought to have at least as good a health care program as their member of Congress. Every American ought to be able to go to bed at night with the security that if their spouse or their children or a loved one in their family were to face a health care crisis, they would not be facing economic ruin, being wiped out because of it. Every American ought to have that sense of security. That's something in this great nation of ours ought not to be depending upon the wealth you have in your family or the job you hold. It ought to be a basic right to be able to have access to affordable, quality health care in America. That's the charge. That's the obligation. That's what stands before us as the issue of not only the day or the hour, but I think of our time here in this Congress. President Obama has said that he's willing to expend every bit of his political capital. That is an extraordinary statement made by an extraordinary president at an extraordinary moment in our nation's history. In my 35 years in Congress, serving with 7 presidents, I've never heard another president on any issue make a similar statement of their willingness to expend their capital on a single issue. This president has made that statement. That ought to inspire all of us. The president, as I hope my colleagues recognize, we've been given a mandate by the American people to deliver on health care reform, and I hope that my colleagues will join in this effort. Already we've made significant progress towards legislation that both cuts costs, protects consumer choice, and guarantees access to affordable quality care for every one of our citizens. The American Medical Association, the American Nurses Association, the organizations representing America's hospitals and pharmaceutical companies have all come to the table, Mr. President, and agreed to support strong health care reform. 3 of 5 congressional committees responsible for health care have already approved strong legislation. And Mr. President, aside, let me tell you, I was here in 1994. Those organizations which I just mentioned, believe me, were not at the table, urging that this Congress stay at the table and pass major health care reform. They are today. That's a fundamental change that's occurred in the last decade and a half. Even the notorious Harry and Louise, those actors who once were used in commercials to kill health care reform, stood with me last week and a group of our colleagues when they announced the first piece of health care legislation to emerge from the United States Senate. They stand strong for health care reform and change and intend to do everything they can to assist in that effort. This bill, the one that passed the Health Committee, the Affordable Health Care Choices Act, is a strong and sensible piece of legislation, Mr. President. It forbids insurance companies from cherry-picking applicants based on their gender, based on their health care status, or any pre-existing conditions. Never, ever again, under our legislation, if adopted, would an American citizen be denied coverage of health care because he or she is a cancer survivor or the victim of domestic violence. Never, ever again, under our bill, Mr. President, would an American citizen who thought they had insurance find their coverage cut or taken away just at the moment they need it the most. Because our bill, if it's passed, Mr. President, not only eliminates caps on benefits, it bans insurance companies from cutting or taking away coverage after a policy has been signed. Our bill, Mr. President, if adopted into law, cracks down on waste and fraud, focuses on preventive care, reduces the crushing burden of administrative costs, and has been scored by the Congressional Budget Office at $611 billion over 10 years. That's a savings of more than $400 billion from the original estimate by the Congressional Budget Office. Mr. President, I'm very proud that we came in on time and under budget in the Health Committee. We're not being talked about much these days because we got our job done a week ago today. But I'm even more proud that with real contributions from each of the 22 members of my colleagues who serve on that committee, a quarter of the United States Senate, we were able to craft a uniquely American bill for the American people. In the United States of America, Mr. President, we already find much we like in our health care system. We like our family doctors and compassionate nurses. We like our world-class hospitals and technology, and we should. They're remarkable. We like having the freedom of choice as Americans of our own health care and the ability to get it fast if we can. And our bill won't touch these things that work in our health care system in the United States today. In the United States of America, Mr. President, we hold the relationship between a doctor and his or her patient to be sacrosanct. And our bill, if written into law, signed into law, guarantees that nothing can ever, ever, ever come between you and the doctor of your choice. Not the federal government, not an insurance company, not a bureaucrat from the private or the public sectors. In the United States of America, Mr. President, we believe in shared risk and shared responsibility. Our bill, if signed into law, lowers costs for everyone by ensuring that everyone is insured. The bigger the pool, obviously, the broader the risk and the lower the cost. In return, our bill asks individuals, employers, the federal government, all of us to share responsibility, not just for treating people when they get sick, but hopefully for preventing them from getting sick in the first place. In the United States of America, Mr. President, we know in our committee as we drafted the bill that good companies aren't afraid. Our bill includes a public insurance option that is just that, It's an option, purely voluntary for consumers and providers to decide whether or not they want to participate. Nothing mandatory, just a voluntary option, a little healthy American competition to give consumers and providers some choices in the healthcare system of our nation. That's an outrageous and radical thought, I know to some. In most communities, it's pretty basic, pretty common sense, and pretty traditional. As red-blooded American ideas, a little competition doesn't hurt anybody. In fact, we suspect it actually helps most. In the United States of America, Mr. President, we have the best treatment and research facilities in the world, facilities that regularly produce remarkable advances. And our bill, if signed into law, ensures that those advances translate directly and efficiently into better outcomes and lower costs for our fellow citizens. Most of all, Mr. President, in our United States of America, we've learned the hard way that we need health care reform. For nearly 70 years now, Democrats and Republicans, of presidents and Congresses alike have all tried at this. Every one of them have made a Herculean effort to deal with this issue. And here we are, close to a century later, still in this same ditch, unable to dig ourselves out of it as it gets deeper and deeper and deeper. And so, Mr. President, this is the moment. This is why we're here. This is our opportunity now to step up or to step back. And history will judge which of the two directions we took at this moment. Whether or not we had the intestinal fortitude and the determination to sit down for the long, hard hours and hammer out something to deliver, not because it's good for us, but because it's good for the people we seek to represent. That's why we're here. We talk about these debates as if no one else existed. Who's working on this? Who's bipartisan? Who's not? What coalition and group? Who's a blue dog or a red dog? It must drive the American people nuts watching us, acting as if we're the only people on the face of this planet wrestling with this issue. We never have to worry. None of us. Tonight, when we go to sleep, you can sleep soundly as a United States congressman or a United States senator. Because if you wake up in the morning with a health care crisis, there's nothing to worry about financially. We are well protected and taken care of. Unfortunately, for millions of our fellow citizens all across this country, they cannot sleep as soundly as we do. And they're the ones that we ought to be thinking about in this debate. Not whether or not we've got some coalition that's going to produce some magical result. Keep our eye on the ball. The American people expecting nothing less from us. And for far too often, of course, we have failed in these efforts that are defeated by nothing more than cheap politics in too many instances, the well-being of our citizens left to drown in today's political current. All the while, we have paid, of course, a deep, deep price for that ditch that we are in, a ditch that's growing. American families pay an average of $1,100 extra, $1,100 extra. If you bought insurance and you have an insurance policy, by and large, you're paying $1,100 more every year in premium costs to cover the costs associated with the health care for the 47 million of our fellow citizens who are uninsured, who get health care. It's not that they don't get health care, they show up. Where do they show up? They show up in emergency rooms. The most expensive health care in the country are in emergency rooms. So when you're paying tonight, as many Americans will be, that quarterly or monthly or whatever the time frame is for the premiums you pay, and look at a percentage of what you're paying. And on average, you're paying $1,100 more every year to cover the uninsured, who get paid, the cost of their health care gets paid for. You're paying for it. So when people say we can't afford any more costs on all of this, you're already paying an exorbitant amount. And one of the efforts in this bill, and our bill, along with the efforts being made by others, is to see to it that the 47 million, a number that expands to 87 million at one point during the year, again, a lot of people find coverage at various times during the year, but in many instances, at one point or another, that many of our fellow citizens are without insurance at all. But that's the price tag, $1,100 on average for our fellow citizens covering the uninsured. 3 out of every 5 bankruptcies, I've mentioned already, in the United States of America are caused by high medical bills. And more than 75% of those forced into bankruptcy because of medical bills, by the way, that number are not the uninsured. 75% of people who fall into bankruptcy are insured. The 62% of the bankruptcies that are created by a health care crisis, 75% of those people had a health insurance policy. So don't just assume this only happens to those people who have no health insurance. If you're insured tonight and you run into a major crisis, health care crisis, then you could very well find yourselves in the same position that millions of our fellow citizens have who fall into bankruptcy. It's not the destitute. It's average American families in many cases. Half of our nation's foreclosures are a direct result of our broken health care system, as we now know. But it's not just families and businesses being bankrupt. Health care costs have come to consume a simply unsustainable portion of our budget. I know the other day when the Congressional Budget Office answered that question in the Budget Committee about are we bending the curves up or down for these various health care plans. And I have a lot of respect for the people who work at the Congressional Budget Office. I know they work very hard. But I'll be a little wager, Mr. President, that no one on that committee, the Budget Committee, nor did the CBO in their calculation of cost ask the question of whether or not bankruptcies or foreclosures were calculated into the cost of whether bending the curves one way or another were part of their conclusions. But why aren't they? If 62% of all bankruptcies occur in the country because 75% of the people insured couldn't afford the health care needs they had for their family, why is that not a cost to be calculated in bending curves? And what about those foreclosures, the 50% of which occur because of a health care crisis in that family? Did the CBO write that number in its computer models to figure out cost? Why not? Is not that a cost to our country? If a family goes into bankruptcy or loses their home because of a health care crisis that's created by the present situation living in this country, where are the calculations and computer models that will tell us the impact of those crises in families? And so we talk about this issue. We're told now in these macroeconomic terms by actuaries and accountants and the green visor crowd that 17% of our gross domestic product is spent on health care, and that number could quickly climb to 35%. What does that mean? It means we're told in the next 8 or 10 years if we don't act, if we listen to those who don't think the last 70 years or the last number of Congresses that we've wrestled with these issues is somehow wasted time, and that we could end up with the average family paying 50% of its gross income on health care premiums. That's not an exaggeration. That's not a phony prediction. The very same economists who are telling you about the 17% of our gross domestic product consumed today are the ones who predict, based on the present trajectories, unchanged, that 35% of our GDP could be consumed by health care costs. You might be curious to know, what other nation in the world has anything like this? The next nation that's closest to us as a percentage of its gross domestic product is Switzerland. And Switzerland spends a little over 10% of its gross domestic product on health care. And then the next country is us, of around 17% and growing. So to give you some idea around the world how we rate, how compare on a per capita basis. Pretty staggering numbers. And by the way, you might say, well, you know, look, I'm sorry, Senator, I know it's a lot of money, but you know what? We have great outcomes. We have remarkable outcomes. So we're paying more than Switzerland. But by golly, our people here get great outcomes. Well, I wish I could tell you that was the case. The fact of the matter is we rank 37th in the world in outcomes. That's a great statistic. The United States of America, the wealthiest nation on the face of this earth, we spend more, $2.5 trillion a year than anybody, a larger percentage by almost double what the closest other nation does in the world, and we rank 37th in the world in medical outcomes. There's something staggeringly wrong with that picture. With that amount of money being spent and those outcomes coming in. And if you wonder why people are frustrated by the subject matter, and they may not know these numbers, all they know is what they're going through in their family. And if we continue on this path, it only gets worse. And by the way, to add additional shame to that number, we rank at the bottom of all industrialized nations when it comes to infant mortality. The bottom of industrialized nations when it comes to infant mortality in the United States of America. I find that shameful, those numbers. I believe every American, I don't care what your politics are, we like to think of ourselves as doing so many things so well as a country, that because of who we are and how we govern ourselves and the opportunities we create, that in the United States of America, this is not some third or fourth world country, that we would take good care of our newborns. And to rank at the bottom of the list among industrialized nations in infant mortality is shameful. To come in 37th in medical outcomes is shameful. And to spend almost double of the gross domestic product in our nearest competitor, if you will, nation, is also shameful. We've reached a point, Mr. President, where no senator can, with a straight face, stand on the floor of this body and argue for the status quo. That status quo is just not only unacceptable, as I've said, it's unsustainable. Instead, of course, some will stand on this floor and argue that the best thing we can do when confronted with a house on fire is to walk around it a few more times and argue about how high the flames have grown. Well, Mr. President, when we began writing this legislation out of the Health Committee, we didn't forget that each of us was born with one mouth and two ears. We started with a blank page. Long before I was asked to pinch hit for Ted Kennedy, Senator Kennedy and his staff and others invited the minority early on to share their ideas. Now, you're going to hear otherwise. We got drawn into this and we're not informed. That's not the case. They were drawn in. They were invited. They had no idea what they wanted to offer, only that they got nervous about this plan going forward. And that started, I'm told, at the end of last year, not when the president was inaugurated after January 20th. And so we began by listening. We listened to stakeholders, providers, hospitals, pharmaceutical companies. Anyone we could gather who had an interest in the subject matter was invited to come and talk about what they thought a national health care reform package ought to look like. And the culmination of that effort was to draft a bill. Why do we draft a bill? Well, because the rules of the Senate require it. You can't begin a markup in the Health Committee unless you've got a product on the table. It's got to be legislation, written. The rules require it. So we wrote a bill and put it on the table and invited our colleagues on the committee to come and comment on it, talk about it, amend it, change it, do whatever they thought might improve it. And that's what took us the 60 hours over 15 days and 23 sessions and somewhere between 300 and 500 amendments. A rather long, elaborate process. And it was good work. And frankly, the bill got a lot better because of the effort. And it got better because my Republican colleagues offered terrific ideas. Contrary to what some may think, they didn't come and just shove their hands in their pockets and their heels in the sand and refuse to participate or walk away and not show up. Mike Enzi, Judge Gregg, Lamar Alexander, I get down the long list of the Republican members who were there, came day after day, sat in that committee room, and contributed mightily to our effort. I was blessed to have Tom Harkin and Barbara Mikulski and Jeff Bingaman and Patty Murray, who were asked by Senator Ted Kennedy back months ago if they would each take on a separate idea. Tom Harkin grappled with prevention issues, developed a staff with expertise and knowledge. Barbara Mikulski worked on quality issues, did the same as Tom Harkin. Patty Murray did it on workforce. Jeff Bingaman did it on coverage. They had 11 or 12 hearings themselves on the subject matter, even before a word was written on the bill, to bring people together to listen to ideas and how we could strengthen those ideas as part of the structure of reform for the healthcare system. And then that culminated with us sitting down, beginning back 5 or 6 weeks ago now, to actually mark up this bill, as we are expected to do. True, my Republican friends on our committee did not vote for the bill. I've said that, regretfully. It was pretty clear to me that that was probably going to happen no matter what we did. But they contributed, and they made significant contributions. Of the 161 amendments, Mr. President, that we accepted, offered by the Republican side of the 300-plus amendments that we considered, 161 amendments offered by the minority are very much a part of the bill that I've been talking about this evening. Some were technical amendments, clearly were, but many were very, very substantive. And I will include in the record chapter and verse of Republican substantive amendments which improve the quality of this bill. Now, they don't want to admit it, maybe, because they voted against it in the end. And you can define bipartisanship any way you want. But I define it by contributions made to the product. And they made a bipartisan contribution to the product in a better bill. It's not a perfect bill. It obviously needs more work. A sensible bill that ought to enjoy the support of our colleagues. Senator Gregg, for instance, and a number of his fellow Republicans were concerned about the long-term fiscal impact of our provisions on long-term care. And so Judge Gregg offered an amendment that would require the Health and Human Services to set and adjust premiums based on a 75-year outlook of the program's solvency. We had a robust debate, went on for an hour or two, on this issue. And the committee recognized the tremendous value, frankly, of what Judge Gregg was proposing. And so his amendment was accepted unanimously. And the bill is a better bill for it. Johnny Isaacson, my very good friend from Georgia, brought to the table the issue of end-of-life care, drawing on his own family's experiences. Very moving remarks he gave in our committee about the importance of end-of-life care issues. And he was able to talk about the importance of planning for the last days of one's life, how difficult that can be. I just went through that with my sister, who was diagnosed on May 22nd with lung cancer, and she was gone in 6 weeks, died on July 6th, the first of my siblings to be lost. 68 years of age, 5 children, 17 grandchildren. She knew in the last 9 days of her life what the outcome was going to be. And so she insisted upon each of us spending an hour or so with her, alone. Every one of her 17 grandchildren, every one of her children, their spouses, every one of her siblings, and every one of her close friends. Her best friend in the world was a woman she met on the first day of college when she was 18 years of age. Her name is Nancy Pelosi, the Speaker of the House. She was there for the funeral. Joe Biden came up. Joe and my sister were great friends. And he came up for the wake the night before. So I know what she was thinking about, my sister, and planning what she wanted to have happen those last 9 days of her life. A lot of families go through that. Johnny Isaacson made a very substantial contribution. Nothing technical about what he was talking about. And our bill is a better bill because Johnny Isaacson's ideas were incorporated in it. Mike Enzi and Judge Gregg and Lamar Alexander wanted to increase employers' flexibility to offer workplace wellness programs with incentives for employees. Some of my fellow Democrats had reservations about their proposal. But Senator Tom Harkin of Iowa and myself and several others on the committee worked with our colleagues on the Republican side to craft a compromise, a version that we were able to pass on a bipartisan basis unanimously. And as a result, today, employers at some point can offer as much as a 50% reduction in premiums to employees who engage in lifestyle behaviors that will reduce their threat of illness and thus bring down the cost to those people. It was a great idea. We attribute a lot of it to Stephen Byrd, the CEO of Safeway, who brought the ideas to the table. But our fellow Democrats, working again with Mike Enzi and Judge Gregg and Lamar Alexander, came up with those ideas in that compromise. That's not technical. And the bill is a better bill because of their efforts. I could go on, I won't this evening, and the rest of the members who made contributions, every one of them, to this bill. But let me be clear. If we deem bipartisanship more important than timely and effective health care reform, the only thing will be bipartisan will be our collective failure as an institution. I've introduced a lot of bills over the years, Mr. President, passed a lot of legislation here. On every major bill I've written in this place, I've had a Republican partner, going back to the earliest days when I arrived here and authored the first child care legislation since World War II. My ally in that was a guy named Orrin Hatch from Utah, who stood with me, and we passed it. I authored the Family and Medical Leave Act. That took 7 years, 2 vetoes. Today, there's some 60 or 70 million Americans who take leave without pay, without losing their jobs. My partner in that was Dan Coates of Indiana, our inspector, who at the time was a Republican, obviously, along with people here that were deeply involved in the issue. Kit Bond played a very important role in the developing of the Family and Medical Leave Act. I'd go on with a list here of bills, but every single one of them, Mr. President, I had bipartisan support. So I understand the value of it. It's a very important means by which we get a job done. But let me suggest to you at this hour, while bipartisanship is a means to get to an end, what really is missing right now is leadership in all of this. Each one of us being a leader. The President is leading as strong as he can, deeply involved in this issue. Members of various committees are also leading. But in this institution, everybody's a leader if they want to be. And right now, I think what the country is looking for is leadership. Yes, bipartisanship is a nice quality, an important element to pass bills. But leadership is what's most missing in all of this. the willingness to understand the moment, the unique opportunity to address a crippling issue that faces our country. Every single one of our citizens will be adversely affected if we fail to act. There are very few bills that can ever make that claim. And yet health care issues affect 100% of the nation. Most bills we deal with percentages. Family and medical leave, 60 million were benefited by it, far short of the 300+ million in our country. Health care affects every single one of our citizens. And why, again, it demands our attention and our resolution. And so to those who are not ready to join in this effort, we invite your suggestions, your improvements, your thoughts to come to that table. Listening to some of our colleagues say this is all about defeating the president or making sure that no one has a political victory. What planet are they living on to believe this debate ought to be about who wins and who loses a political contest on this issue? Again, it's not about us. It's about people across this country who are expecting a lot more from us. They don't wake up and wonder what political party they belong to or what section of the country they live in. If their child gets sick, if their spouse is sick and struggling and needing help, the last thing they want to hear about is whether or not they're a Democrat or a Republican or an independent or live in a green state, a blue state, a red state, or whatever other color you want to attribute to them. They want to know whether or not we have the sense and the sensibility to deal with this issue. The truth is, we've waited too long. We've waited far so long, Mr. President. We've waited decades now. And the American people are waiting even longer. And their wait is much more painful than ours. There's no cause for delay. Yes, you've got to examine the bill. We've got to look at it, consider suggestions. But that only happens when you sit down and work together. We spent those 60 hours in the Health Committee, and it wasn't easy and it wasn't comfortable, and people got tired and frustrated at various moments. And there were times I thought it was going to fall apart. But I knew if we ever stopped and walked away, then those who wanted no result, no answer to this, would win. And so day after day, I asked my colleagues to come back and sit at that table and work. And what I said earlier, I mean deeply. There were those who, frankly, might have decided not to show up, and that might have had a political conclusion, but they did. My Republican colleagues, as well as my Democratic colleagues, showed up every single day and worked to make that a better bill, even though there were those who voted against it. So there's no cause for delay, there's no cause for obstruction, and there's no excuse for inaction, in my view. In a few weeks, we'll return to our various states for the so-called August break, although, frankly, I'm prepared to stay here and work. That may not be a popular idea, but I can't think of anything more important than this issue, including whether or not we take some time off in August to go to the beach and go to the mountains and go to the lakes, or wherever we go, visit with our constituents. Well, remember that every day we're on our break, another 14,000 every day, and that August break we'll be without health care at the end of that day, every day, 14,000 a day, while we're drifting off instead of engaging what we ought to be doing, in my view, coming to terms with this issue. Some will be among the ranks of the uninsured. Some were struggling and scared, bearing the emotional and physical scars that come with delaying the foregoing needed care, worrying that one car accident, one diagnosis could mean bankruptcy, foreclosure, or in fact the inability to get any care at all. Some will have insurance, but they'll share the same worries because their insurance costs are much too high and covers far too little. They'll be thinking about the jobs they wish they could leave, maybe start a small business but can't because they'd lose their insurance lifeline. They'll be wondering whether their plan will decide to cover cancer, screening their doctor, told by their doctor they actually need it. How many visits to the hospital, how many visits to the doctor, will it be adequate? Some won't be worried about their insurance today, but they'll be among the millions who will lose their insurance if they don't step up to the plate and take some action. But everyone we see when we go home will be watching us over the next 3 weeks. You better believe they're going to ask us about health care. They're going to ask us whether we're up to the job of passing a bill this year. They're going to ask us why we haven't made more progress. Fundamental questions, ones that we'll have to answer for ourselves based on what we do in these coming days and weeks. At this very moment, Mr. President, We stand at the cusp of history, one of those unique moments. Doesn't happen very often around here, but every now and then it happens, and we're in one. And it's not going to last long. It's really only going to last a few more weeks, maybe a couple of months, as to whether or not in this moment we have the ability to rise up and do what we should be doing, even though it doesn't meet our ideals, not the bill each one of us would write on our own. But that moment when we recognize our failure to act at all is a moment missed and not likely to be recaptured during our tenure. I know for newer members here, that may seem like an exaggeration, but to those of us who've been here a while, we'll tell you these moments don't come very often. Most of the time we spend on issues to deal with momentary issues of floods and hurricanes and devastation of one kind, and go through the routine of reauthorizing bills, reappropriating money, and that consumes about 95% of our time. Not unimportant business, be the first to admit, but fairly routine. And every now and then, in our nation's history, there have been moments of critical importance. Early 1960s, the Civil Rights Act, the Voting Rights Act, Medicare, going back in the Depression years, the Eisenhower years, and the federal highway system in our country. You can point at various times in the 20th century when, contrary to what everyone else thought, this institution decided to take on an issue that made a difference in our country. I suspect Barack Obama, in part, had a chance to be elected President of the United States because the people he never knew and never knew him sat here day after day, week after week, and engaged in the debate on civil rights, back long before any of us were ever here, except one. Bob Byrd was here. Ted Kennedy was here. Those two members actually were in this chamber in those days in early 1960s. And today, we're a lot better country. We're a lot better country because of it. And that was one heck of a fight, let me tell you. I was a young page sitting on the floor here in the summer of 1961 and 62 when Lyndon Johnson was sitting where the presiding officer is, watching the all-night debates on civil rights. And they were raucous, and they were wild, and they were tough. And there was no bipartisanship on that, I can tell you. It was downright tough and nasty. Those memories fade. What retains and recalls is the fact that this institution had leaders that stood up and said, we're going to get this done. And they achieved those results. And today we celebrate those moments. We've forgotten about the bitterness that occurred in the debates. No one's asking whether it was bipartisan or not, or whether or not coalitions got what they wanted or not. The response was the United States got closer to that more perfect union that our founders described more than 2 centuries ago. Well, we're in that kind of a moment again. In many ways, this is a civil rights debate about health care, because too many of our fellow citizens are denied that right of health care based on economic circumstances beyond their control. And the issue is very simply this: will we come together and decide at a moment like this to get a job done? Or will we take the easier path and step back because it's a little too tough? Others have failed at it. It means I might lose some votes back home. Might even lose an election over this one. But there are certain issues that are worth losing an election over. That's not the worst thing to ever happen to someone. Watching your family go bankrupt, losing your home, watching a child or a spouse suffer because they don't have enough money to buy health care, that's a problem, Mr. President. That's a real problem. Having your constituency send you back home at the end of an election is not a real problem, believe me. That's an easy problem to solve. And so the issues here are complicated. I know that. I know they're difficult. I know if they were easy, they would have been solved a long time ago. But I have a lot of confidence. I listened to 22 of my colleagues over 5 weeks in a markup, become educated and grapple with these issues. We didn't resolve all of them, but we educated ourselves and made a difference and produced a bill that now is the only one in this chamber that is before us. And we hope our colleagues would examine it, take a look at it, make whatever recommendations they could as we move forward. I know the Finance Committee is wrestling with this. Max Baucus and I arrived on the same day in Congress in 1975. We've been friends for 35 years. And I know he's struggling to get the right kind of bill to come out of that committee. And I wish him the very best and have offered whatever help we can to assist in that effort. But I hope we're going to get a product that moves forward that we can embrace and be proud of, that will make a difference. And so for the coming days, I won't take as much time as I have this evening, but I want to talk about this bill in detail. I want to engage in the debate, politics, the bumper sticker slogans about things that don't exist, the fear that's so easy to arouse in people, the easiest emotion to appeal to. people's fears and hates, and talk constructively and positively about what we can do together to overcome this issue that is a scourge in our society and worthy of this chamber's efforts. So, Mr. President, I thank the patience of my colleagues this evening for listening to all of this. Thank the patience of the chair. And I look forward to the hour when we will come together as a body here, not as Democrats or Republicans, but as United States senators at this moment, and pass a major health care reform bill that moves our country to accessibility, to affordability, and the quality of health care. And I yield the floor. On a separate matter, I want to note that some 20 minutes ago, the junior senator from Alaska, the presiding officer, is the first member of this new class to come in to win the Golden Gavel for presiding over 100 hours of Senate business. And so I'm the only one here in the chamber, but I give you a round of applause.
Thank you very much. Thank you, Senator.
And I'm proud to have been here engaged in this discussion, to have you presiding over this conversation. So I thank you very much, Senator Begich, and congratulations on serving our Senate as admirably and as well as you have over these 100 hours.
Thank you from the Senator for Connecticut, and thank you for the invitation. Senate stands adjourned until 9:30 Thursday, July 23rd.